So let's start with general pathology first. Under that, we'll see about cell injury starting. So under cell injury, we'll be discussing about cellular adaptations, reversible cell injury, irreversible cell injury. Then we'll see about the various forms of cell death, then autophagy, intracellular accumulations, then pathological calcification and cellular aging. So whenever there is a injury to a cell, so initially the cell will try to adapt to the new environment. So it will undergo certain changes which are called as cellular adaptations. And those cellular adaptations are hypertrophy, hyperplasia, atrophy and then metaplasia. So these four are called as the cellular adaptations. After that, if the injurious stimuli is still persistent, the cell will undergo reversible cell injury. So there will be certain changes which are still reversible if the stimulus are being removed. Then if the stimulus is then still persistent or quite heavy, then in that sense it will undergo a irreversible cell injury. So an irreversible cell injury will then culminate in a cell death. So we have various forms of cell death which are necrosis, apoptosis, then we have necroptosis, then pyroptosis, then pheroptosis, then anoicus. So these new forms of cell death apart from the conventional necrosis and apoptosis are quite new and they are potential for being asked in MCQs. So what is the most common cause of this cell injury? So it is hypoxia. So whenever hypoxia is there, it is going to result in cell injury. And what is the most common cause of this hypoxia? It is going to be ischemia. So loss of blood supply will lead to decrease in the oxygen supply as well. That is resulting in hypoxia. So what are the organs which are quite sensitive to hypoxia? So the most sensitive tissue to hypoxia will be neurons. So they can withstand hypoxia only for about 3 to 5 minutes. After that, they are going to undergo irreversible cell injury. Then the most resistant tissue to hypoxia will be fibroblasts. And cardiac muscle are usually sensitive to hypoxia for up to 30 minutes. So after which they will undergo irreversible cell injury. So myocardial infarction, you are supposed to treat it within half an hour. So within 30 minutes if they come, so in that case you can revert the injury. Okay. Then we'll start with the cellular adaptations first. So cellular adaptations, as I mentioned, these are going to be some reversible changes which the cell undergoes in response to some stimuli. So this stimuli can either be a pathological stimulus or a physiological stimulus. So these changes are going to let the cell live. So it can adapt to this new environment because of these changes. So these changes are reversible. So remember, reversible is the word which is important here. So we will see about the various cellular adaptations. So starting with hypertrophy. So hypertrophy literally means there is going to be increase in the cell size. Okay, the size of the cell is going to increase. So when the size of the cell has to increase, the cellular contents has to increase. So the proteins in the cells are going to be increased. So some transcription factors will be activated and upregulated, which will result in the increased protein synthesis, which will then result in the hypertrophy. So what are the examples of hypertrophy? You can either have physiological examples and pathological examples. Physiologically, hypertrophy happens in bodybuilders. You must have seen their bodybuilders, their muscles are quite heavy. So their big muscles are due to this hypertrophy. Their skeletal muscles, they increase the skeletal proteins, and that is how the skeletal muscles undergo hypertrophy. And the same thing happens in lactational breast as well. So a feeding mother, the breast is going to, the ductal elements are going to undergo hypertrophy. So that is how hypertrophy can result in a engorgement of the breast. Then pathological hypertrophy, the most common example will be in the left ventricle. So whenever there is going to be a pressure or a volume overload. So pressure overload can be due to either a hypertension or some stenosis like aortic stenosis, and volume overload usually it is going to be due to some regurgitations. Suppose there is a mitral regurgitation, so there is going to be aortic regurgitation, so there is going to be lots of blood which is going to be accumulated in the left ventricle. So in order to accommodate for this pressure and volume overload, the left ventricle will undergo hypertrophy. Since cardiac muscle cannot divide, so these cells can only undergo hypertrophy. So usually hypertrophy happens in those cells which are not capable of division. Okay, so hypertrophy will happen in these cardiac muscle either as a concentric hypertrophy or an eccentric hypertrophy. So we'll be seeing about that during when we are discussing cardiovascular system. So the left ventricle will undergo this hypertrophy to accommodate for this stimulus, which is either a pressure or a volume overload. So next change will be the hyperplasia. So hyperplasia is literally meaning increased in the cell number. So the number of cells is increasing. So when will the number of cells increase? Only when the cells are capable of division. So when the cells undergo division, they proliferate, and that can result in hyperplasia. So what are the examples of hyperplasia? Again, it can be physiological and pathological. So physiological causes, suppose you are resecting a liver. So a part of the liver is being resected, but still the entire liver can grow back to the normal size. So even if only a part of the liver is left in the body, so rest of it has been given for transplant, even still the liver can regrow to its original size. That is because liver cells are capable of division because they have the oval cells. So oval cells are the stem cells which are capable of proliferation, and the liver cells can regenerate completely. So liver cells can undergo hyperplasia whenever needed. Same for bone marrow. Suppose there is a trauma to the patient and there is lots of blood loss. So in order to compensate for this blood loss, the bone marrow will try to produce lots and lots of their blood elements. So blood cells are going to increase. So bone marrow will undergo hyperplasia over here. Same hemolytic anemias also. During hemolytic anemias, the RBCs are being lysed. So RBCs are being lysed and lost. So in order to compensate for this loss in RBCs, the bone marrow will try to increase the production of RBC. So it will undergo increased, it will stimulate hematopoiesis and erythropoiesis, and that is actually a result of hyperplasia. Okay. So in pathological causes of hyperplasia, we have three main examples. The first one will be endometrial hyperplasia. So endometrial hyperplasia, endometrial tissue is sensitive to estrogen. So whenever there is an increased estrogenic stimulus, it is going to result in endometrial hyperplasia. So this endometrial hyperplasia is important because it is a pre-neoplastic condition. So this endometrial hyperplasia can progress on to become a cancer. So it can result in endometrioid cancer. So endometrioid cancer is going to be type 1 endometrial cancer. So in endometrial cancers, we have two types, type 1 and type 2. So the type 1 best example will be endometrioid cancer, which is going to result from the preneoplastic condition, which is endometrial hyperplasia. The next example will be a benign prostatic hyperplasia. So benign prostatic hyperplasia is also called as nodular hyperplasia of the prostate. So it is not a preneoplastic condition. Endometrial hyperplasia is a preneoplastic condition. So if you don't remove this estrogen, it is going to become cancer. But BPH or nodular hyperplasia of prostate, it is not preneoplastic. Okay, it is just the hyperplasia of both the epithelial and the stromal components of the prostate in response to dihydrotestosterone. Okay, it is going to be due to dihydrotestosterone. So testosterone is going to be converted into dihydrotestosterone with the help of 5-alpha reductase enzyme. So testosterone is going to convert into dihydrotestosterone with the help of 5-alpha reductase. So this dihydrotestosterone is the one which is responsible for causing this nodular hyperplasia of the prostate. Okay, it's not testosterone, it's dihydrotestosterone. So if you want to relieve this patient of this hyperplasia, so this hyperplasia is going to result in urinary complaints in the patients. So if the patient has to give symptomatic relief, you will have to block this conversion into dihydrotestosterone. So if you block this 5-alpha reductase enzyme, the patient's symptoms will be released. So we can use drugs like finasteride, which can inhibit this 5-alpha reductase. Then other example of hyperplasia will be HPV warts. These HPV warts are caused by low risk human papilloma virus, which are strains 6 and 11. So they result in these HPV warts, which are called as condyloma acuminatum. Okay. So these have a characteristic change in their cells called as coilocytes. Coilocytes are the viral cytopathic effect caused due to HPV infection. So coilocytes are nothing but these cells will have a racinoid nucleus, meaning it will appear like a raisin. The nucleus is going to be irregular with a irregular nuclear membrane, and surrounding this nucleus you are going to have a perinuclear halo. So suppose this was the cell, this is the racinoid nucleus we see here, and then surrounding this you have a perinuclear halo. So this is what we call as a coilocyte. Okay, so these are all examples of hyperplasia. Okay, we'll see about a controversial question over here. So in a gravid uterus, what happens? So in gravid uterus, the size of the uterus is going to be enlarged, right? So gravid uterus undergoes both hypertrophy and hyperplasia. Okay, it is going to be both hypertrophy and hyperplasia, but it is hypertrophy which is much more than a hyperplasia. So remember it as uterus has a T here, so T in hypertrophy will be much more predominant. So hypertrophy is much more predominant in a gravid uterus. However, in a breast, in a pregnant female or a pubertal age group, so there again the breast engorgement is going to be there, and this breast development in puberty and pregnancy, here also both hyperplasia and hypertrophy will take place, but here it is hyperplasia which is more than hypertrophy. So P for pregnancy, P for puberty, and B also resembles like P, so P is going to be more. So hyperplasia is more than hypertrophy in breast engorgement during pregnancy and pubertal age group. So let's see about the third cellular adaptation, which is atrophy. So atrophy literally means decrease in the cell size and number. So it is going to be the exact opposite of both hypertrophy and hyperplasia, right? So for the cell to increase in size, the cell had to increase the protein synthesis. Similarly, for the cell to increase in number, the cell had to divide. So when atrophy is happening, it is the reverse. So the proteins which were produced has to degrade now, and in order to the number of the cell has to decrease. So the cell has to undergo death. So for the cell to decrease in size, that is to decrease the protein synthesis, the proteins are going to be degraded by the ubiquitin proteasome pathway. Okay, so ubiquitin proteasome pathway will degrade the proteins, so that will result in the decrease in the cell size. While the cells can undergo apoptosis, so the cells can undergo apoptosis, that will result in the decrease in the cell number. Okay. So what are the examples of atrophy? Whenever you don't use anything, so something is going to undergo atrophy. Even if you don't use your brain is going to undergo atrophy. Okay, so that is what we call it as disuse atrophy. Suppose the patient is having some trauma, some leg fracture. So the patient is lying on the bed without moving about. So immobilization will result in disuse atrophy of the lower skeletal muscles. So the calf muscles will undergo skeletal atrophy. So, similarly, if there is a loss of blood supply or loss of nerve supply, again that part of the body is not going to be used up to the mark. So it will result in ischemic atrophy or denervation atrophy. Then pressure atrophy. So the best example of pressure atrophy will be in a leiomyoma. So in leiomyoma, what happens? It is a benign smooth muscle tumor. So when any benign tumor is going to grow slowly. So when it is going to grow slowly, it is going to compress the host tissue. Okay, if it is a malignant tumor, it would have grown rapidly and invaded the tissue. But benign tumors grow slowly and they compress the host tissue which is surrounding it. So the compressed host tissue with time can undergo atrophy due to the pressure. Okay, so that is called as pressure atrophy. The same thing can also happen during bed sores. So the patient is lying about and they are developing bed sores. So again, the result is actually due to the pressure atrophy. Then malnutrition. So during malnutrition, again there is going to be atrophy and also autophagy. Autophagy I'll be discussing in a while. Okay. So the last example and the most important example for atrophy will be endometrial atrophy. So endometrium can undergo atrophy, and one thing which you have to remember about this is also a pre-neoplastic condition. Okay. Endometrial atrophy can also result in cancer, and here it is going to be endometrial cancer type 2. Okay, endometrial cancer type 2, which is of serous carcinoma morphology. The morphology of endometrial cancer type 2 will be a serous carcinoma. So both endometrial hyperplasia and endometrial atrophy is going to cause cancer. Next, we'll see about the last cellular adaptation, which is metaplasia. Metaplasia means you are going to replace a differentiated tissue into another differentiated tissue. So, replacement of a differentiated tissue by another differentiated tissue is going to be called as metaplasia. And the mechanism by which this happens is reprogramming of the stem cells. So, don't think that a mature tissue is just like that becoming another kind of a mature tissue. It is the stem cells which reprogram themselves to produce some other type of mature tissue. Okay. The best and since it is also a reversible, it is also a cellular adaptation, metaplasia is going to be reversible only. So, best example and the most common metaplasia will be a squamous metaplasia. A squamous metaplasia is usually happens in the bronchus of chronic smokers. So, smoking is actually an irritant, and the bronchial epithelium is going to be of columnar lining. So, ciliated columnar lining is going to be there in the bronchus. But with chronic smoking, what happens? This columnar epithelium cannot take up that much kind of an irritation. So, this will undergo metaplasia into a squamous kind of stratified squamous lining is going to replace this columnar lining. So, stratified squamous lining is the one which we see in skin. So, it is quite of a tough epithelium. So, it can still manage this irritant caused by this tobacco smoke. So, squamous metaplasia will happen in these chronic smokers in the bronchus, and is the most common metaplasia. And this squamous metaplasia can in turn actually convert into carcinoma. So, with time, if they are continuously smoking, this metaplasia can develop into dysplasia, which can proceed on to become a carcinoma. So, this metaplastic change is also precancerous. Another example of metaplasia will be an intestinal metaplasia. So, we all know it by another name, which is Barrett's esophagus. So, Barrett's esophagus happens in the lower end of the esophagus. So, at the lower end of the esophagus in patients who are having gastric esophageal reflux disease. So, due to the loss of tone in the lower esophageal sphincter, so it is going to be lax, and the acid present in the stomach is going to regurgitate into the lower end of the esophagus. So, esophagus is usually lined by stratified squamous epithelium, but this acid which is produced by the stomach is going to be a corrosive agent. So, it is going to irritate the squamous epithelium. So, what has the esophagus is going to try to accommodate for this insult. So, what it will do? It is going to undergo metaplasia into an intestinal lining. So, intestinal lining, we all know it has columnar lining only, but along with the presence of goblet cells. So, goblet cells usually produce mucin, and this mucin can counteract the acid irritation which is produced by the GERD. So, goblet cells will produce acidic mucin, and this is going to be protective for the lower end of the esophagus, but it comes with the cost. So, intestinal metaplasia, which is with the presence of this goblet cells, these goblet cells are the hallmark of intestinal metaplasia or Barrett's esophagus. So, this intestinal metaplasia can actually convert into adenocarcinoma. So, this is again Barrett's esophagus is again a pre-neoplastic condition. Okay, with time, if this gastric irritation is continuously present, GERD is continuously present, this Barrett's esophagus can undergo dysplasia and become an adenocarcinoma. Okay, so how will you confirm this Barrett's esophagus? Since these goblet cells are present, which produces acidic mucin, you can stain with Alcian blue. So, Alcian blue is a special stain which stains this acidic mucin at a pH of 2.5. Okay. Then the third example of metaplasia will be myositis ossificans. It is not just the epithelium is getting replaced, okay. So, even the mesenchymal tissues can undergo metaplasia. The best example of it will be the myositis ossificans. So, post-trauma, you must have seen some patients they'll have a bone development inside the muscle, okay. So, this is called as myositis ossificans. Ossification means bone. Ossification happens inside the bone, right? So, myo is muscle. So, bone is going to be present in the muscle post-trauma. So, this is called as myositis ossificans, which is again an example of metaplasia. So, one other thing is both vitamin A excess and vitamin A deficiency can lead to metaplasia. So the squamous metaplasia I was mentioning, right? So here again it is going to be due to vitamin A deficiency. So vitamin A deficiency can again lead to this kind of squamous metaplasia. So remember, both vitamin A excess and deficiencies lead to metaplasia.